That's so meaningful to a patient to get so many added years with their families.
Throughout human history, advancements in technology have sought to expand the livelihood of people. From agricultural gains to legislation, societies have thrived off of progress. Nevertheless, progress in medicine has truly emphasized the power of science in regards to expanding humanity. From the use of soap to the development of vaccines, medicine has brought populations from loss to expansion. Many of these healthcare practices have attempted to cure one of the leading causes of death since the dawn of time: cancer. Specifically, the first use of chemotherapy treatment in the 1940s greatly impacted the world of medicine. The development of chemotherapy to effectively reduce cancers accelerated the advancement of medicine, thereby focalizing the frontier of cancer treatment in society. Yet, this frontier is once continuously being explored as modern science searches for less harmful practices in hopes to eradicate the disease that affects many. Cancer is a disease caused by the overproduction of cells that leads to the rapid growth of tissue and health depletion. Evidence of human cancer goes back to ancient Egypt, where fossilized bones were discovered to have osteosarcoma, a type of bone cancer. Even further, ancient Egyptians described surgical operations to remove breast tumors in a medical text known as the Edwin Smith Papyrus. In the 1800s, as the Western world modernized through industrialization, rates of cancer rose drastically. From unsafe work practices to poor healthcare, mortality rates of cancer increased. It is also in the post-industrial world where communities, most often due to environmental factors, saw great rates of contained cancer. With increased rates of infection and death, cancer became more and more prevalent in the world of medicine and thus enabled a shift in medical focus towards finding its cure. Throughout the 1800s, a medical revolution took place. A grand medical advancement that occurred before the development of chemotherapy would be the discovery of anesthetic. In 1846, diethyl ether was used to conduct the first pain-free surgery at Massachusetts General Hospital. In the context of cancer, it allowed for some treatment. The surgical removal of small, contained tumors became commonplace. This practice built the foundation of modern cancer treatment and allowed professionals to research more and more. In the late 1800s and into the 1900s, the cancer mortality rate was extremely high.
I mean, it's transformative, right? I mean, people didn't even used to use the word cancer. It was so hush-hush, and it was, this terrible death sentence.
Throughout the world, physicians attempted to find cures for the disease. One of these attempts was radiation treatment, first practiced by oncologists in Sweden who found that basal cell sarcoma, a type of skin cancer, was depleted by X-rays.
They also tried to do like fancier things, like prepare all the RNA out of a tumor and then give the RNA as an RNA vaccine, like the Moderna and, Pfizer vaccines that we all got for COVID.
These discoveries kickstarted a surge in trials surrounding radiation treatment to limit the spread of cancer, and that surge then caused the field to delve into a new treatment: chemotherapy.
The 1940s were a new chapter in both world and American history. As World War II waged forward and the Great Depression came to an end, fighting and death encompassed societies. It was during World War II where naval officers of the Allied powers discovered the powers of mustard gas. While highly toxic and fatal, the gas effectively decreased the white blood cell count and tissue growth in individuals who survived.
This discovery in war, as well as a rise in cancer research, led Alfred Gilman and Louis Goodman to test the gas on mice with lymphoma and saw great reduction in tumors.
This great advancement inevitably caused more and more research into chemotherapy, a term coined by Nobel Prize recipient Paul Ehrlich that describes the treatment of disease by means of chemicals.
In cases where serum therapy failed, Ehrlich would synthesize new chemicals. He coined these agents as chemotherapies.
Gustav Lindskog, chair of surgery at Yale and Massachusetts native, took the findings of Gilman and Goodman and applied them to human trials. In 1942, the three worked together and injected a lymphoma patient with a less volatile compound of mustard gas. This treatment, which occurred over a period of 3 weeks, saw great success in reduction of the tumor size, effectively removing any cancer from the patient.
Thus, the practice of chemotherapy grew and grew. Hospitals such as Massachusetts General Hospital, Philadelphia Children's Hospital, and various hospitals in Europe began to utilize chemotherapy.
Dr. Sidney Farber, a pathologist at Boston Children's Hospital, wanted to study its effects on patients with childhood leukemia. Instead of utilizing mustard gas, Farber tested the effects of other chemical agents known as folic acids. Between 1947 and 1948, Farber ran many trials to see which of these chemotherapies worked efficiently.
In publication, Farber concluded that of these acids, amidoperidone successfully reduced acute childhood leukemia, significantly raising rates of survival.
There was a firestorm because people still believed at that time that cancer was incurable. If you could induce a temporary remission, you had a key to a door.
In this research, he discovered that the chemical effectively blocked cell growth and reproduction by halting DNA replication, meaning that the tumor could not grow, and in turn, the body's immune system could recognize it as harmful. Farber's work was profoundly impactful in the field of oncology. His studies on childhood cancer not only garnered sympathy from the public and legislative bodies, but further advanced cancer research to better understand causes, effects, and other preventative measures individuals could take. By the 1950s, advancements with the findings of Farber, Lindskog, Gilman, and Goodman continued to progress, eventually fighting against testicular, lung, and skin cancer.
There's been an enormous amount of progress in the last 20 years, which can be measured in the actual saving of human lives. Great progress, particularly in the fields of radiotherapy, in the fields of chemotherapy with the use of chemicals. There are many forms of cancer now which can be treated successfully, which just a few years ago could not be treated at all with cures.
You now know you're going to take your life to the next stage. And the next stage, while it's not guaranteed, there's hope.
From this point forward, chemotherapy remained as an extremely vital foundation of cancer treatment.
Evidently, the connection between mustard gas and decreased white blood cells that occurred in World War II stands as the initial launch into the journey of cancer treatment.
Chemotherapy attacks the entirety of the immune system, which weakens the body. Hair loss, severe fatigue and nausea, skin changes, nail decay, mouth sores, and many other hardships arise when individuals undergo treatment. Because of these difficulties, medical professionals throughout America and throughout the world raised questions against chemotherapy.
What he did was against opposition in the 1940s. He was an innovator, and innovators often face a lot of opposition.
In fact, all the way into the 1990s, chemotherapy was still a form of treatment surrounded by skepticism. Many doctors saw that its overuse had extremely negative effects on patients, but then again, its underuse could lead to the progression of cancer.
Chemotherapy is known to cause a lot of nausea and vomiting, and we have now 10 or 12 nausea medicines that are really, really effective, so that patients don't get dehydrated, don't have to be hospitalized for that symptom.
As a result, methods of controlling side effects have advanced greatly to a place where patients receiving chemotherapy treatment can still work and live with some normalcy.
And now, after 4 years after chemo, I feel normal.
From chemotherapy, scientists continued to synthesize new cancer treatments. Specifically in 2011, the first clinical approval of immunotherapy took place.
Immune therapy is really different because the treatment itself is not toxic to any particular dividing cell. It's really based on the immune system recognizing the difference between what we call self and non-self. And in that process, it learns to recognize what's normal you versus anything else. And it doesn't care what anything else is. If it's not you, it's going to attack it.
Nevertheless, the advantages of chemotherapy are still impactful today. As more and more time has passed, researchers have increased the precision of chemotherapy and the ways in which it attacks tumor cells instead of the body's healthy cells. Since re-entering the frontier of cancer treatment, the utilization of chemotherapy on a global scale has greatly increased. As of 2018, 57.7% of diagnosed cancer was treated with some form of chemotherapy. In the US specifically, that number is a whopping 79.2%. Then again, chemotherapy still has some drawbacks. Its time in the medical world has been short and thus difficult. Some cancers are less treatable with chemotherapy, and the ones that can be treated still come with some heavy side effects. However, those negatives are overwhelmingly compensated by the benefits in tumor reduction and remission rates. Chemotherapy today is also used in tandem with surgery, making survival rates for breast, testicular, prostate, and skin cancer higher than ever before. All this progress since chemotherapy entered the medical frontier emphasizes that it not only continues to work and grow, but that the treatment itself is a part of a great frontier to finding a cure for cancer.
I wouldn't be surprised if in 10 or 20 years we're all getting an annual blood test to look for tumor DNA in the bloodstream.
All in all, the use of chemotherapy in a clinical sense to fight cancer both introduced and expanded the frontier of treatment. This frontier, whilst being difficult, remains at the forefront of medical advancement and continues to progress to a cancer-free future.
It feels like your life has a lot of meaning and what you're doing feels like it's important, and it doesn't feel like work. It feels like it's a privilege.
Thank you for saving my life.